You think modern medicine is scary? You complain about waiting hours in emergency rooms, about invasive procedures, about the cold touch of surgical instruments? Tonight, while you rest comfortably, knowing that a simple antibiotic can save your life, I'm going to show you what really happened when you fell ill in 1250. And when I'm done, you'll never look at your local hospital the same way again. Because what I'm about to reveal isn't just history, it's a mirror reflecting how thin the line between healing and torture has always been. Picture this. It's a crisp morning in medieval Europe, and you wake up with what we'd call today a simple fever. Your head pounds, your throat burns, your body aches. In 2024, you'd pop an ibuprofen and maybe see a doctor if it persists. But in 1250, you've just received a death sentence, and you don't even know it yet. The moment your family notices your condition, you become a walking experiment in humanity's most brutal attempts at understanding the human body. Let me whisper something that medical textbooks won't tell you. Medieval medicine wasn't primitive because people were stupid. It was horrifying because they were desperate. Desperate enough to try anything, to believe anything, to do anything to a suffering human body in the name of healing. And the truly disturbing part? Some of their methods worked, though nobody understood why, and the price paid in agony was astronomical. Your medieval doctor approaches your bedside, and the first thing he does isn't check your pulse or temperature. He examines your urine, not with modern lab equipment, but by holding it up to candlelight, swirling it around, and sometimes tasting it. Yes, you read that right. The man who's supposed to heal you begins by drinking your piss, analyzing its color, consistency, and flavor, like a sommelier examining fine wine. The sweetness might indicate what we now know as diabetes, but to him it suggests an imbalance of humors that requires immediate bloodletting. Here's where it gets beautifully grotesque. Medieval medicine was built on the theory of four humors: blood, phlegm, yellow bile, and black bile. Your fever? Clearly too much hot blood coursing through your veins. The solution seems logical in their twisted worldview. Remove the excess blood. But this isn't the careful, measured bloodletting you might imagine from movies. This is medieval enthusiasm applied to human veins. The barber surgeon arrives at your bedside with tools that look more like instruments of torture than healing. His primary weapon? A fleam, essentially a medieval switchblade designed specifically for opening human flesh. But here's the part that will make your skin crawl. They didn't just make small, precise cuts. They believed in dramatic bloodletting, sometimes removing up to half of your total blood volume. Imagine lying there, already weakened by fever, watching pint after pint of your life essence drain into crude bowls while your vision blurs and your consciousness fades. But wait, it gets worse. If direct bloodletting doesn't appeal to your medieval healer's sensibilities, he might opt for cupping. Picture heated glass cups being pressed against your feverish skin, creating suction so intense it pulls your flesh up into grotesque purple bulges. The goal? To draw bad blood to the surface where it can be released through strategic cuts. You lie there looking like you've been attacked by a giant octopus, your skin a map of painful welts and oozing wounds. And if cupping seems too gentle, enter the leeches. Not the clean, medical leeches used in modern reconstructive surgery, but wild leeches pulled from stagnant medieval ponds, carrying who knows what diseases in their slimy bodies. Dozens of them, sometimes hundreds, attached to your already suffering flesh, gorging themselves on your blood while injecting their anticoagulants to keep the feast flowing. You feel each one latching on, a wet, cold sensation followed by the peculiar numbness of their natural anesthetic. Hours pass as these living vampires drain you, growing fat and glossy while you grow pale and weak. The truly insidious part about medieval bloodletting wasn't just the immediate trauma, it was the logic trap it created. If you got better after losing massive amounts of blood, clearly the treatment worked. If you died, you obviously hadn't lost enough blood quickly enough, or the disease was simply too powerful. The treatment could never be wrong, only insufficient. This circular reasoning led to increasingly extreme methods, each more horrifying than the last. Your medieval doctor might decide that your specific fever requires the precision of arterial bleeding. Unlike venous bloodletting, which taps into the dark blood of your veins, arterial bleeding targets the bright red, high-pressure blood pumping directly from your heart. The barber surgeon locates your temporal artery, the one that throbs visibly at your temple when you're stressed and makes a careful incision. But arteries don't cooperate like veins. The blood doesn't drain steadily into a bowl, it shoots out in rhythmic spurts, painting the walls of your chamber in crimson arcs that pulse with each heartbeat. The room fills with the metallic smell of fresh blood mixed with the acrid smoke of cauterizing irons, kept hot in braziers, specifically for sealing wounds when the bleeding has gone far enough, or when you're too close to death to continue. The hissing sound of hot metal against raw flesh becomes a soundtrack to your suffering, accompanied by your own screams and the muttered prayers of whatever family members can stomach watching this medieval massacre disguised as medicine. But here's what makes this historical horror particularly disturbing. It wasn't random violence. These weren't sadistic torturers enjoying human suffering. These were trained professionals, the most educated people in their communities, following carefully documented procedures passed down through generations of medical practice. They genuinely believed they were saving lives, applying the best scientific knowledge available to them, The road to hell, paved with good intentions, has never been more literally blood-soaked. The psychological torture accompanying the physical ordeal might have been even worse than the pain itself. Imagine lying there, fever-addled and weak, watching these respected healers discuss your case in Latin while periodically testing your blood's color and consistency. They speak over you as if you're already dead, debating whether your particular combination of symptoms requires the removal of blood from your left arm versus your right, whether the optimal timing is dawn or dusk, whether the phase of the moon affects the potency of the treatment. Medieval medical texts, preserved in monastery libraries, describe bloodletting procedures with a clinical detachment of modern surgical manuals. They specify exact amounts of blood to be removed based on the patient's age, build, and astrological sign. Yes, your treatment protocol depended partly on when you were born and how the stars were aligned when you fell ill. A Scorpio with a fever required different bleeding patterns than a Gemini with the same symptoms. The intersection of astronomy and anatomy created treatment plans that seem like elaborate rituals designed by a sadistic cult. And if standard bloodletting fails to cure your medieval fever, the escalation protocols make modern medical interventions seem gentle by comparison. Scarification involves making hundreds of small cuts across your skin, creating a crosshatch pattern that turns your body into a human colander. Each cut is shallow but precise, designed to release bad humors through multiple exit points simultaneously. You become a living piece of art, painted in your own blood, while medieval physicians observe the pattern of drainage like fortune tellers reading entrails. The most disturbing aspect of this historical medical nightmare isn't the pain, though that was unbearable. It isn't even the frequent death, though mortality rates were astronomical. It's the trust. Patients submitted to these tortures willingly, desperately, hopefully. Families paid substantial sums for treatments that often amounted to elaborate execution methods. The sick begged for procedures that would make modern torture seem merciful. They believed, with the same faith we place in modern medicine, that these blood-soaked rituals would restore their health. This isn't ancient history happening in some distant, primitive culture. This was Europe, the foundation of Western civilization, less than 800 years ago. The cathedrals, whose beauty still takes your breath away, were being built by people who thought the best way to treat pneumonia was to drain half your blood while Mercury was in retrograde. The same hands that carved intricate stone roses also wielded phlemes and cupping glasses with equal precision and confidence. But this story about what happened when you fell sick in 1250 hasn't ended. Every time you hesitate before a medical procedure, every time you question a doctor's recommendation, every time you seek a second opinion, you're channeling the same survival instinct that should have saved medieval patients from their well-meaning executioners. The next time you complain about modern healthcare, remember that we're only a few centuries removed from physicians who thought drinking your urine was diagnostic brilliance. And consider this unsettling question. What medical procedures that we consider routine today will horrify people in 2800? But this medieval medical nightmare was just beginning. Because what I've shown you so far, the bloodletting, the leeches, the scarification was considered basic treatment, the medical equivalent of taking aspirin. Wait until you discover what medieval physicians did when they decided your case required serious intervention. When bloodletting fails to cure your medieval fever, when the leeches have gorged themselves and fallen off your pale skin like bloated grapes, when scarification has turned your body into a canvas of weeping wounds and you're still burning with sickness, that's when medieval medicine reveals its true face. That's when your physician stops pretending to be gentle and embraces the full horror of what healing meant in 1250. Your medieval doctor examines your weakened state and declares that your humors are severely imbalanced, that the corruption has penetrated deeper than surface bloodletting can reach. The solution? Trepanation, the deliberate drilling of holes through your skull while you're conscious, aware, and screaming. But this isn't some primitive ritual performed by ignorant savages. This is sophisticated medical intervention, documented in detailed manuscripts, taught in the few medical schools of the era, and practiced by the most respected healers in Christendom. The trepanation procedure begins with your head being shaved completely, leaving you exposed and vulnerable like a sacrificial offering. Medieval barber surgeons didn't understand infection, so the razor used on your scalp was the same one used on the previous patient, carrying whatever diseases that person harbored directly into the microscopic cuts on your newly bald head. Then comes the marking, as the surgeon uses charcoal to draw precise circles on your skull, mapping out exactly where he intends to bore through bone into the soft tissue of your brain beneath. The drilling begins with a tool called a trepan, essentially a medieval corkscrew designed for human skulls. But unlike modern neurosurgery, there's no anesthesia, no pain medication, nothing to dull the excruciating sensation of metal grinding through bone. You feel every revolution of the drill, every scrape against your skull, every moment as the bit works deeper toward your brain. The sound is unbearable, a wet, grinding noise that reverberates through your skull and into your teeth, making your entire head vibrate with each turn of the surgeon's hand. Medieval medical texts describe trepanation patients who remained conscious throughout the entire procedure, their eyes wide with terror, their mouths open in silent screams as the drill penetrated their skulls. Some patients bit through their own tongues. Others passed out from pain, only to be awakened with smelling salts, so the surgeon could continue his work on a conscious patient, believing that awareness was necessary for successful treatment. The truly disturbing detail? Many patients begged for this procedure to continue, even as they screamed, convinced that this agony was their only hope for survival. When the trepan finally breaks through your skull with a sickening pop, releasing a spray of blood and brain fluid, the medieval surgeon peers into the hole he's created like he's looking into a sacred well. He's searching for visible signs of corruption, expecting to see bad humors pooling beneath your skull like spiritual sewage. Sometimes he finds what he's looking for: blood clots, swollen tissue, anything that looks abnormal to his untrained eye. Sometimes he finds nothing but healthy brain tissue, pink and pulsing with your heartbeat. But here's where medieval medicine becomes truly nightmarish. They don't stop there. If one hole doesn't release enough corruption, they drill another and another. Some skulls from medieval graveyards show evidence of multiple trepanation attempts, turning the patient's head into something resembling a Swiss cheese made of bone and suffering. Imagine lying there, your skull perforated like a colander, brain fluid leaking down your face, while the surgeon debates whether a fourth hole might finally release the demons causing your fever. The aftermath of trepanation was often worse than the procedure itself. Medieval physicians had no concept of sterile technique, so the open wounds in your skull became breeding grounds for infection. They covered the holes with whatever seemed appropriate cloth soaked in wine, animal fat mixed with herbs, sometimes just leaves gathered from the surgeon's garden. Your perforated skull became a garden of corruption, growing exotic bacteria that medieval science couldn't identify or treat. But trepanation was only one option in the medieval physician's arsenal of horrors. If drilling holes in your head seems insufficiently aggressive, they might opt for the more direct approach of opening your skull with a saw. Medieval skull saws looked like instruments designed by demons, with curved blades and jagged teeth specifically crafted for cutting through human bone. The sawing process took hours, with frequent breaks to let the blade cool and to prevent the bone dust from clogging the teeth. Picture the scene. You're strapped to a wooden table in a dim chamber lit only by flickering candles, the smell of burning bone mixing with incense meant to ward off evil spirits. The surgeon works methodically, sawing through your skull while assistants hold your head steady and wipe away blood and bone fragments. The sound is indescribable, like a carpenter working on particularly stubborn wood, except the wood is your skull, and every stroke of the saw sends vibrations through your consciousness. Medieval medical manuscripts describe patients who remained alert throughout skull sawing procedures, some even engaging in conversation with their surgeons. These weren't superhuman individuals with extraordinary pain tolerance. They were ordinary people whose terror-induced adrenaline kept them conscious through unimaginable agony. Their recorded words, preserved in medical texts, read like transcripts from hell. Please, stop. I can feel it in my thoughts. The pain is eating my soul. When your skull is finally open like a horrific jewelry box, medieval physicians encounter the human brain in all its mysterious complexity. But they interpret what they see through the lens of humoral theory and religious doctrine. That grayish-pink tissue pulsing beneath your open skull isn't the seat of consciousness, memory, and personality as we understand it today. To them, it's simply another organ that can be cleaned, drained, and purified like a corrupted liver or infected lung. Medieval brain surgery involved physically manipulating brain tissue with crude instruments. Surgeons would use small spoons to scoop out what they perceived as corrupted matter, essentially performing lobotomies without understanding the consequences. They removed blood clots, drained fluid accumulations, and sometimes excised entire sections of brain tissue that appeared discolored or abnormal. Patients who survived these procedures often emerged as completely different people, their personalities fundamentally altered by medieval attempts at neurological intervention. The most disturbing aspect of medieval brain surgery wasn't the immediate pain or even the frequent death. It was the patients who survived with severe brain damage, becoming living testimonials to the horrors of well-intentioned medical intervention. These survivors often exhibited what we now recognize as symptoms of traumatic brain injury personality changes, memory loss, difficulty speaking or walking, seizures, and behavioral problems that medieval society attributed to demonic possession or divine punishment. Medieval medical records describe post-surgical patients who no longer recognized their families, who spoke in tongues, who exhibited violent outbursts or catatonic episodes. Instead of recognizing these symptoms as consequences of brain trauma, medieval physicians often interpreted them as evidence that the surgery had successfully expelled demons or evil spirits, even though the patient's original illness remained uncured. But here's what makes this historical horror particularly relevant to our modern world. These weren't isolated incidents performed by rogue practitioners. Medieval trepanation and brain surgery were standard medical procedures, taught in universities and performed by the most respected physicians of the era. The same intellectual tradition that gave us Gothic cathedrals and scholastic philosophy also produced detailed manuals on how to drill holes in conscious patients' skulls. Medieval medical schools trained students in brain surgery using techniques passed down from ancient Greek and Roman physicians, modified by Islamic medical scholars, and refined through centuries of experimentation on suffering patients. This wasn't primitive barbarism, it was the pinnacle of medieval medical sophistication, representing the accumulated wisdom of the world's greatest healers. The tools used for medieval brain surgery were crafted by skilled artisans, often decorated with religious symbols and blessed by priests before use. These weren't crude implements hastily assembled for desperate situations. They were precision instruments, carefully maintained and proudly displayed by surgeons who considered themselves elite members of society. The trepanns, saws, and brain spoons were works of art, beautiful objects designed for horrific purposes. Medieval patients often paid substantial sums for brain surgery, viewing it as the ultimate medical intervention, worth mortgaging family property or selling livestock to afford. They approached these procedures with hope, faith, and desperate gratitude, seeing their surgeons as saviors rather than torturers. The contrast between intention and outcome creates a historical irony so profound it challenges everything we think we know about progress and civilization. Consider this unsettling reality. Every medieval patient who submitted to brain surgery believed they were receiving the best medical care available in the world. They trusted their physicians completely, just as you trust yours today. They viewed skeptics of medieval medicine the same way modern patients view those who reject contemporary medical advice as ignorant, superstitious, and dangerously misguided. The parallels between medieval and modern medical faith should make you deeply uncomfortable. We mock medieval patients for submitting to trepanation while we cheerfully accept procedures that future generations might view as equally barbaric. The same trusting relationship that led medieval patients to drilling tables leads modern patients to operating rooms where we allow strangers to cut open our bodies based on interpretations of symptoms that are sometimes no more accurate than medieval humor theory. But the brain surgery was just the beginning of what medieval medicine had in store for your sick body. When opening your skull failed to cure your fever, when manipulating your brain tissue only made you worse, that's when medieval physicians really got creative. Wait until you discover what they did to your other organs and how they decided which parts of your body needed to be removed to save your life. Your medieval fever persists despite having your skull perforated like a medieval colander. The corruption, your physician declares, has spread to your internal organs. The solution isn't medication or rest, it's surgery. But this isn't the sterile, anesthetized surgery you know from modern hospitals. This is medieval surgery, where the operating table is often the same wooden plank used for butchering livestock, where surgical instruments are sharpened on the same whetstones used for kitchen knives, and where the concept of sterilization extends no further than wiping blood off blades with whatever cloth happens to be available. Medieval abdominal surgery began with what they called opening the belly, a procedure that sounds deceptively simple until you understand what it actually involved. Without anesthesia, you're conscious, as the surgeon makes a long, deep incision across your abdomen, cutting through skin, fat, and muscle while you scream and struggle against the leather straps binding you to the operating table. The pain isn't just local, it's a full-body experience that makes your entire nervous system feel like it's on fire. The medieval surgeon works by candlelight, peering into your opened abdomen like he's examining the contents of a mysterious chest. But here's what makes this particularly horrifying. Medieval physicians had only rudimentary knowledge of internal anatomy. Their understanding of organ function came primarily from dissecting animals and the occasional criminal's corpse, supplemented by ancient texts that were often wrong. When they looked inside your living body, they were essentially improvising, guided by theories that had more in common with religious doctrine than medical science. Your opened abdomen becomes a landscape of speculation and guesswork. That inflamed appendix? Medieval physicians might identify it as a worm of corruption that needs to be extracted. Your enlarged spleen? Obviously a repository of black bile that requires immediate removal. Kidney stones? Demonic eggs that must be cut out before they hatch into supernatural parasites. Every abnormality they discover becomes evidence of supernatural influence requiring increasingly aggressive intervention. Medieval surgical instruments were works of terrifying artistry. The amputation saw, designed specifically for cutting through human bone, featured teeth that curved backward to prevent the blade from slipping during use. The bone chisel, used for splitting ribs and removing sections of skull, was essentially a miniature axe sharpened to surgical precision. The cauterizing irons, kept glowing hot in braziers throughout the procedure, were shaped like branding tools because that's essentially what they were, instruments for burning human flesh closed when suturing seemed insufficient. But the most disturbing medieval surgical instrument was the lithotomy knife, designed specifically for cutting bladder stones out of conscious patients. This wasn't a simple scalpel, it was a curved, hook-shaped blade that surgeons inserted through the perineum, the sensitive area between your genitals and anus, then used to fish around inside your bladder until they located and extracted kidney stones. The procedure, called cutting for the stone, had a mortality rate approaching 50%, not from the stones themselves, but from the surgical trauma and inevitable infection that followed. Picture yourself strapped to a medieval operating table, legs spread and secured in leather restraints, while a barber surgeon inserts a curved knife into your most sensitive areas and begins fishing around inside your bladder, like he's trying to retrieve coins from a fountain. You feel every movement of the blade, every scrape against internal tissue, every moment of the surgeon's hand as he probes inside your body, searching for stones he can't see and might not even be there. Medieval surgical texts describe lithotomy patients who died not from blood loss or organ damage, but from shock induced by pain so severe it caused their hearts to stop. Others survived the initial procedure only to develop infections that turned their surgical wounds into festering craters that never healed. The lucky ones died quickly. The unlucky ones lingered for weeks, their bodies slowly consuming themselves as infections spread through their abdominal cavities. When internal surgery seemed too risky or unsuccessful, medieval physicians turned to amputation as their solution for persistent illness. The theory was elegantly simple. If corruption has infected a limb, remove the limb and save the rest of the body. But medieval amputation wasn't the relatively precise procedure we know today. It was brutal, urgent surgery performed with tools designed for carpentry rather than medicine. Medieval amputation began with the application of a tourniquet, usually a leather strap twisted tight with a wooden rod, until circulation to the limb stopped completely. But tourniquets in 1250 weren't the calibrated medical devices we use today. They were improvised restraints that often cut off circulation so completely that the limb began dying even before the amputation began. Patients frequently developed gangrene in their limbs while waiting for surgery, making the eventual amputation even more horrific. The actual cutting involved multiple instruments and techniques that seemed designed to maximize suffering. First, the surgeon used a sharp knife to cut through skin and muscle, working in circles around the limb to create flaps of flesh that could later be folded over the bone stump. Then came the bone saw, a serrated blade that required vigorous back and forth motion to cut through human bones. Medieval bone saws weren't precision instruments, they were essentially carpentry tools adapted for human anatomy. The sound of medieval amputation was unbearable. The wet cutting of flesh, the grinding of saw teeth against bone, the hissing of cauterizing iron sealing blood vessels, and above it all, the screams of the patient who remained conscious throughout the entire procedure. Medieval medical texts describe amputation patients who bit through leather gags, who broke their own teeth from clenching their jaws, who dislocated their shoulders from struggling against restraints. But here's what makes medieval amputation particularly disturbing. The survival rate was actually surprisingly high, especially compared to other medieval surgical procedures. Many patients lived through the immediate trauma of having limbs sawed off without anesthesia. They adapted to life with missing arms or legs, learned to use crude prosthetics carved from wood and leather, and returned to some semblance of normal existence. This success rate convinced medieval physicians that amputation was an effective treatment for a wide variety of ailments. Medieval medical logic created a horrifying escalation pattern. If amputating a finger cured an infection, perhaps amputating a hand would cure a more serious illness. If removing a foot helped one patient, maybe removing an entire leg would help another. Medieval hospitals filled with patients who had been systematically dismantled by well-meaning physicians, their bodies reduced to torsos and stumps in the name of medical progress. The psychological trauma of medieval amputation might have been worse than the physical pain. Imagine watching surgeons debate which of your limbs to remove, listening to them discuss your arms and legs like they're examining a butcher's inventory. You hear them planning your dismemberment while you're fully conscious, aware and terrified, unable to escape or resist because you're bound to the operating table and dependent on these same people for any hope of survival. Medieval prosthetics were crude mechanical devices that often caused more problems than they solved. Wooden legs attached with leather straps created pressure sores that became infected. Iron hands with simple gripping mechanisms were heavy, uncomfortable, and frequently broke at crucial moments. Many amputees abandoned their prosthetics entirely, preferring to adapt to life without the missing limb, rather than endure the constant pain and mechanical failures of medieval artificial limbs. But the most disturbing aspect of medieval amputation wasn't the immediate trauma, or even the long-term disability. It was the cascade effect that often followed. Amputation wounds frequently became infected, leading to additional amputations higher up the same limb. Patients who lost fingers often ended up losing entire hands. Those who lost hands frequently lost arms. Medieval medical records describe patients who entered hospitals with minor infections and left as multiple amputees, their bodies progressively shortened by surgical interventions designed to save their lives. Medieval physicians developed elaborate protocols for determining which body parts to remove and in what order. These weren't random decisions, they were systematic approaches based on humoral theory and astronomical calculations. Your surgeon might consult star charts to determine the optimal timing for amputation, or examine your urine color to decide whether your left arm or right leg posed a greater threat to your overall health. The financial aspects of medieval surgery created additional horrors. Wealthy patients could afford multiple procedures, leading surgeons to recommend increasingly aggressive interventions as long as payment continued. Poor patients often received partial treatments cutting that stopped when money ran out, leaving them with infected wounds and incomplete procedures that guaranteed future suffering. Medieval surgical fees were calculated by body part, with hands costing more than fingers, arms more than hands, legs more than arms. This pricing structure created perverse incentives for surgeons to recommend major amputations over minor ones, and for desperate families to negotiate over which pieces of their loved ones they could afford to have removed. Consider the economics of medieval medical horror. Surgeons made more money from cutting off your entire leg than from treating the infected toe that might have been the actual problem. Families mortgaged their homes to pay for procedures that left their breadwinners permanently disabled. The medieval medical system wasn't just physically brutal, it was economically predatory, designed to extract maximum payment for maximum dismemberment. But even systematic amputation was merely preparation for what medieval physicians considered their ultimate weapon against persistent illness. When bloodletting failed, when brain surgery accomplished nothing, when removing limbs didn't cure your fever, that's when medieval medicine revealed its final, most horrifying solution. Because in 1250, when all else failed, they decided the problem wasn't with your individual organs or limbs, the problem was with the very essence of what made you human. Your medieval fever has now persisted through bloodletting, brain drilling, organ removal, and systematic amputation. You've become a living testament to the failure of medieval medicine, a breathing collection of surgical scars and missing parts that somehow still clings to life. But rather than admitting defeat, your medieval physician reaches a chilling conclusion. Your illness isn't medical at all, it's spiritual, and spiritual corruption requires spiritual surgery, performed not just on your body, but on your very soul. Medieval medicine drew no clear distinction between physical and mental illness, between bodily corruption and spiritual contamination. If traditional surgical interventions failed to cure your persistent fever, the logical next step was to treat what they perceived as demonic possession or spiritual corruption, manifesting through physical symptoms. This wasn't a different medical specialty, it was the same physicians, using the same surgical tools, now applied to problems they believed originated in your immortal soul. The medieval diagnosis of spiritual illness began with symptoms that we now recognize as psychological distress, neurological damage from previous surgeries, or simple delirium from fever and blood loss. But medieval physicians interpreted confusion, personality changes, and erratic behavior as evidence that demons had taken residence inside your already damaged body. Your soul, they concluded, had become infected just like your flesh and required equally aggressive intervention. Medieval spiritual surgery started with exorcism, but not the theatrical Hollywood version you might imagine. Medieval exorcism was a medical procedure, performed by physician priests who combined surgical skills with theological training. They approached demonic extraction the same way they approached kidney stone removal, with sharp instruments, detailed protocols, and absolute confidence that their methods would succeed where gentler approaches had failed. The first stage of medieval spiritual surgery involved physical restraint more comprehensive than anything used for regular operations. Patients suspected of demonic possession were bound not just to prevent movement during surgery, but to prevent the demons inside them from attacking the physicians performing the exorcism. Leather straps secured every limb, metal clamps held the head immobile, and iron bits forced the mouth open to prevent the possessed patient from biting their tongue or spitting at their healers. Medieval physician priests believed that demons could be physically extracted through surgical incisions made in specific locations on the body. They created detailed maps of the human form showing demonic entry points, places where evil spirits typically entered the body, and corresponding extraction sites, where surgical intervention could force them out. These weren't random locations, they were precisely calculated based on astrological charts, biblical numerology, and anatomical theories passed down from ancient texts. The surgical extraction of demons involved making deep incisions at these predetermined sites, then using various instruments to pull out the spiritual corruption. Medieval physicians inserted heated metal probes into these wounds, twisted and rotated them to dislodge stubborn demons, and used specialized hooks to extract spiritual parasites that couldn't be removed through simple cutting. You experienced this as excruciating physical torture, but your physician saw it as sophisticated spiritual intervention. Medieval medical texts describe patients who remained conscious during demonic extraction procedures, screaming not just from physical pain, but from what physicians interpreted as the voices of demons being forcibly expelled from their bodies. These weren't metaphorical screams, they were real human agony interpreted through a medieval worldview that saw suffering as evidence of successful treatment. The more you screamed, the more demons they believed they were successfully removing. But here's where medieval spiritual surgery becomes truly nightmarish. When simple extraction failed, physicians escalated to what they called spiritual amputation. If demons had corrupted specific body parts beyond redemption, those parts needed to be removed to save the rest of your soul. This led to amputations performed not for medical reasons, but for spiritual ones, removing limbs that showed no signs of physical illness because they were believed to harbor demonic contamination. Medieval spiritual amputation followed different protocols than medical amputation. The cutting had to be performed during specific lunar phases, with particular prayers recited throughout the procedure, and the severed body parts had to be disposed of through ritual burning to prevent the demons from escaping and infecting other patients. You lost arms and legs, not because they were physically diseased, but because medieval physicians believed your soul was contaminated. The most disturbing aspect of medieval spiritual surgery was the treatment of what they called demonic pregnancy, the belief that demons could impregnate human bodies with supernatural offspring that needed to be surgically removed. This wasn't limited to women. Medieval physicians believed that demons could implant parasitic entities in anyone's abdomen, regardless of gender or age. The surgical removal of these imaginary demon spawn involved opening the patient's abdomen and removing whatever organic matter physicians found inside. Medieval demonic pregnancy surgery created some of the most brutal medical procedures in human history. Physicians cut open conscious patients' abdomens, removed sections of intestines, extracted normal organs they didn't recognize, and carved out chunks of healthy tissue they interpreted as demonic implants. Patients who survived these procedures often died from infection or internal bleeding, but physicians recorded these deaths as successful demon extractions that, unfortunately, came too late to save the patient's life. The psychological torture of medieval spiritual surgery was arguably worse than the physical trauma. Imagine being told by respected medical authorities that demons have infected your soul, that your own thoughts and feelings are no longer entirely your own, that evil entities are living inside your body and controlling your behavior. Then imagine being told that the only cure requires surgical procedures that will remove these demons by cutting them out of your living flesh. Medieval patients facing spiritual surgery often begged for the procedures, convinced that the terrible pain of surgical demon extraction was preferable to eternal damnation. They submitted to amputations, organ removal, and systematic torture because they believed their immortal souls depended on it. The same faith that led them to accept physical surgery now demanded that they accept spiritual surgery, no matter how agonizing or disfiguring. Medieval spiritual surgery created a category of medical survivors who were simultaneously physically destroyed and spiritually cured. These patients often emerged from treatment as multiple amputees with severe psychological trauma, but they were declared spiritually cleansed and medically successful. Their destroyed bodies became testimonials to the power of medieval spiritual medicine, living proof that aggressive intervention could save souls even when it couldn't save lives. But medieval physicians weren't content with individual spiritual surgery. They developed protocols for treating what they called spiritual epidemics cases, where entire communities seemed infected with demonic influence. This led to mass medical interventions, where dozens of patients received simultaneous spiritual surgery, turning medieval hospitals into scenes that resembled battlefield medical stations or industrial slaughterhouses. Medieval spiritual epidemics typically began with isolated cases of unusual behavior, mass hysteria, ergot poisoning from contaminated grain, or simply the psychological contagions that occurs when people believe they're under supernatural attack. But medieval physicians interpreted these outbreaks as evidence of coordinated demonic assault, requiring military-style medical response. They organized mass treatment sessions, where entire communities received preventive spiritual surgery to stop the demonic infection from spreading. Picture a medieval hospital during a spiritual epidemic. Dozens of patients strapped to operating tables, screaming as physicians performed simultaneous demon extractions, the air filled with smoke from cauterizing irons and burning flesh, the floor slick with blood from multiple surgeries, and above it all, the chanting of physician priests reciting Latin prayers to protect themselves from the demons they're extracting from their patients' bodies. The financial aspects of medieval spiritual surgery were even more predatory than regular medical procedures. Spiritual corruption was considered more serious than physical illness, justifying higher fees and more extensive treatment protocols. Families paid enormous sums for procedures that often killed their relatives, but they paid willingly because they believed eternal salvation was at stake. Medieval physicians became wealthy performing spiritual surgeries that had no basis in reality but generated enormous profits from desperate, terrified patients. Medieval spiritual surgery also created legal complications that regular medicine avoided. Patients who died during spiritual procedures were sometimes declared martyrs, who had sacrificed their lives to prevent demonic contamination from spreading. Others were posthumously accused of harboring demons so powerful that even aggressive spiritual surgery couldn't save them. Medieval medical records became theological documents, with surgical outcomes interpreted as evidence of divine judgment rather than medical success or failure. The most chilling aspect of medieval spiritual surgery wasn't the immediate brutality or even the high mortality rate. It was the absolute certainty with which medieval physicians approached procedures that were essentially elaborate torture disguised as medical intervention. They documented their techniques, taught them to students, and refined their methods based on centuries of accumulated experience torturing patients in the name of spiritual healing. Medieval spiritual surgery represents the ultimate intersection of medicine and faith, where physical intervention becomes religious ritual, and surgical outcomes are interpreted as evidence of divine approval or disapproval. Your body becomes a battleground between good and evil, with medieval physicians serving as warriors wielding scalpels and saws in humanity's cosmic war against supernatural corruption. But the true horror of medieval spiritual surgery lies in its internal logic. Every aspect made perfect sense within the medieval worldview. If demons could possess human souls, then physical extraction was logical. If spiritual corruption manifested through bodily symptoms, then surgical intervention was appropriate. If aggressive treatment saved souls, even when it destroyed bodies, then the procedures were successful, regardless of whether patients survived. Consider this unsettling parallel. Medieval patients who submitted to spiritual surgery displayed the same faith in their physicians that modern patients show toward contemporary medical authorities. They trusted procedures that seem obviously barbaric to us, just as future generations might view some of our current medical interventions as equally primitive and brutal. But medieval spiritual surgery was merely the penultimate horror in the medieval medical arsenal. When even demonic extraction failed to cure persistent illness, when spiritual amputation left patients destroyed but still sick, medieval physicians had one final explanation for treatment failure. And their ultimate solution was so horrifying, so completely divorced from anything we recognize as medicine, that it challenges our fundamental assumptions about the relationship between healing and harm. When your fever persists, despite every intervention medieval medicine can devise, when you've survived bloodletting, brain drilling, organ removal, systematic amputation, and spiritual surgery, yet still burn with illness, medieval physicians reach their ultimate conclusion: you are not sick, you are cursed. And curses, unlike diseases, cannot be cured through medical intervention. They can only be transferred, contained, or destroyed along with their host. Medieval curse medicine represented the final frontier of medical desperation, where physicians abandoned any pretense of healing and embraced procedures designed not to cure patients, but to protect society from whatever supernatural contamination they represented. You become not a person to be healed, but a threat to be neutralized, a walking plague that must be contained through methods that make previous medieval treatments seem gentle by comparison. The medieval theory of curse transference was elegantly simple and absolutely horrifying. If a curse cannot be removed from its host, it can be transferred to someone or something else through deliberate infection procedures. Medieval physicians developed elaborate protocols for moving curses from valuable patients to expendable hosts, typically condemned criminals, slaves, or anyone society considered disposable. Your curse becomes someone else's death sentence, imposed through medical procedures designed to deliberately spread supernatural contamination. Medieval curse transference began with the creation of what physicians called sympathetic wounds, precise injuries inflicted on both the cursed patient and their intended recipient, designed to create a supernatural connection between their bodies. These weren't simple cuts, they were elaborate surgical procedures that created matching patterns of damage, establishing what medieval medicine believed were channels through which curses could flow from one person to another. Picture the scene. You lie on one operating table, while a condemned criminal lies on another, both of you conscious and aware as medieval physicians create identical incisions across your bodies. The surgeon moves between tables using the same blade to cut matching wounds in both patients, believing that shared blood and shared pain will create the sympathetic connection necessary for curse transference. You watch your curse being carved into another human being, knowing that their death is the price of your potential recovery. But curse transference required more than matching wounds. Medieval physicians believed that the actual transfer occurred through the deliberate mixing of bodily fluids, creating what they called sympathetic contamination. This involved forcing cursed patients to vomit, urinate, or bleed directly into the mouths and wounds of their intended recipients, literally feeding one person's corruption to another in the hope that the curse would follow its familiar biological pathways into a new host. Medieval medical texts describe curse transference patients who were forced to spit into each other's mouths, to urinate into each other's wounds, to press their bleeding injuries together, while physicians recited incantations designed to encourage supernatural migration. The procedures were simultaneously medical and magical, combining surgical precision with ritual elements that transformed operating chambers into scenes from humanity's darkest nightmares. When curse transference failed, medieval physicians escalated to what they called curse imprisonment, the surgical implantation of cursed patients with objects designed to trap supernatural contamination inside their bodies. These weren't healing devices, they were spiritual prisons, meant to contain curses that couldn't be removed or transferred. Medieval curse imprisonment involved cutting open conscious patients and inserting blessed metals, sacred stones, or religious relics directly into their flesh, then sealing the wounds around these objects with deliberate imprecision that guaranteed infection and ongoing pain. Medieval curse imprisonment created patients who carried permanent foreign objects inside their bodies, objects that were never meant to be removed. These unfortunate souls lived with chunks of iron, pieces of stone, or fragments of religious artifacts embedded in their flesh, causing constant pain and recurring infections that medieval physicians interpreted as evidence that the curse was successfully contained, rather than evidence that the treatment was causing additional suffering. But the most disturbing aspect of medieval curse medicine was the development of what physicians called preventive curse procedures, surgical interventions performed on healthy people to protect them from supernatural contamination. Medieval medicine had evolved beyond treating the sick to mutilating the healthy in the name of spiritual prevention. Entire communities submitted to prophylactic surgeries designed to make them immune to curses that might never materialize. Medieval preventive curse procedures involved the surgical implantation of protective objects in healthy patients, creating deliberate wounds that would supposedly repel supernatural contamination. Healthy children received surgical scars carved in religious patterns, had blessed metals inserted under their skin, or were subjected to controlled infections with holy diseases that were believed to provide immunity against demonic influence. Medieval medicine had begun consuming the healthy to protect them from becoming sick. The pediatric applications of medieval curse medicine represent some of the darkest chapters in medical history. Medieval physicians believed that children were particularly vulnerable to supernatural contamination, leading to the development of infant curse prevention procedures that involve systematic scarification, deliberate infection, and the surgical implantation of protective devices in babies who had committed no crime other than being born into a world terrified of supernatural influence. Medieval infant curse prevention included procedures like holy scarification, the systematic cutting of religious symbols into babies' skin to create permanent protective marks, blessed infection, the deliberate introduction of specific diseases believed to provide supernatural immunity, and spiritual vaccination, the surgical implantation of cursed objects that were supposed to train young immune systems to resist supernatural contamination through controlled exposure to evil influence. Picture medieval hospitals where healthy infants were systematically mutilated in the name of supernatural protection, where parents paid substantial fees to have their babies infected with diseases believed to prevent worse supernatural contamination, where the cries of suffering children were interpreted as evidence that protective procedures were successfully driving away evil spirits. Medieval preventive medicine had become indistinguishable from systematic child abuse disguised as health care. But medieval curse medicine reached its ultimate expression in what physicians called community purification, mass medical interventions designed to protect entire populations from supernatural contamination through coordinated surgical procedures performed on every member of society. Medieval community purification involved the systematic surgical modification of entire towns, creating populations of deliberately scarred, infected, and mutilated people who believed their collective suffering protected them from supernatural threats. Medieval community purification campaigns typically began during times of crisis, plagues, famines, or military defeats that were interpreted as evidence of supernatural attack against entire communities. Medieval physicians organized mass surgical interventions where every resident received mandatory curse prevention procedures, creating towns full of people bearing identical scars, carrying matching surgical implants, or suffering from deliberately induced infections, designed to provide community-wide supernatural immunity. The logistics of medieval community purification were staggering. Physicians organized assembly-line surgical procedures where hundreds of patients received identical treatments in single session. Operating tables were arranged in rows, with surgeons moving from patient to patient performing the same incisions, implanting the same protective devices, or inducing the same preventive infections with industrial efficiency that prioritized throughput over individual patient care. Medieval community purification created entire populations of surgical survivors, towns where every resident bore evidence of medical intervention designed not to cure illness, but to prevent supernatural contamination that might never occur. These communities became living monuments to medieval medical philosophy, populated by people who had sacrificed their physical integrity for theoretical spiritual protection. But the true horror of medieval community purification lay in its voluntary nature. These weren't procedures imposed by tyrannical authorities. They were requested, demanded, and paid for by communities that believed collective surgical sacrifice was their only protection against supernatural threats. Medieval populations organized, funded, and participated in mass medical mutilation because they had been convinced that their physical suffering was necessary for spiritual survival. Medieval medical records document community purification campaigns where entire towns mortgaged their collective wealth to pay for mass surgical procedures, where communities competed to demonstrate their commitment to supernatural protection through increasingly extreme medical interventions, where population-wide scarification and surgical implantation became civic duties comparable to military service or tax payment. The psychological impact of medieval community purification created societies where surgical scars became social currency, where the absence of preventive medical mutilation marked individuals as spiritually irresponsible or supernaturally vulnerable. Medieval communities developed hierarchies based on the extent of surgical modification their members had undergone, with the most extensively mutilated residents gaining social status as the most spiritually protected. Consider the social dynamics of medieval communities, where surgical scars indicated virtue, where deliberate infection demonstrated civic responsibility, where the absence of medical mutilation suggested moral failure. Medieval society had evolved to the point where physical wholeness became suspicious, where healthy bodies were interpreted as evidence of spiritual corruption or social irresponsibility. Medieval curse medicine also created professional categories that existed nowhere else in human history. Curse diagnosticians specialized in identifying supernatural contamination that required medical intervention. Curse surgeons developed techniques specifically for supernatural rather than medical problems. Curse prevention specialists organized community-wide surgical campaigns designed to protect entire populations from spiritual threats. These weren't charlatans or religious fanatics, they were trained medical professionals who had developed elaborate specialties around the surgical treatment of supernatural problems. Medieval medical schools taught courses in curse identification, supernatural surgery, and community purification techniques with the same academic rigor applied to more conventional medical subjects. The intersection of medieval curse medicine with legal systems created additional horrors. Courts began requiring medical evidence of curse contamination before pronouncing certain legal judgments. Suspected criminals were subjected to medical examinations designed to identify supernatural influence. Legal punishments included mandatory medical procedures designed to remove curses that courts believed had caused criminal behavior. Medieval legal medicine created situations where criminal trials became medical procedures, where surgical intervention was prescribed as legal punishment, where medical diagnosis determined legal guilt. The boundary between medicine and law disappeared entirely, creating a system where physicians wielded judicial authority and legal authorities prescribed medical procedures. But medieval curse medicine's ultimate legacy wasn't the immediate suffering it caused, or even the massive mortality rates it produced. Its true horror lay in the complete corruption of the healing relationship, the transformation of medicine from a practice dedicated to preserving life into a system designed to sacrifice individual welfare for theoretical collective protection. Medieval curse medicine represents the logical endpoint of medical authoritarianism, where physicians gained such complete social authority that they could prescribe suffering for healthy people in the name of protecting them from problems that existed only in medical theory. It shows us what happens when medical expertise becomes indistinguishable from supernatural belief, when scientific method gives way to systematic delusion backed by surgical instruments. Yet this wasn't the end of medieval medical horror, because even curse medicine, with all its systematic brutality and supernatural logic, was merely preparation for the ultimate medieval medical revelation. The discovery that some illnesses were so persistent, so resistant to every form of intervention, that they could only mean one thing. The patient wasn't cursed, infected, or possessed. They were already dead, and medieval medicine had one final procedure for treating the living dead: